Well, good morning, good morning. It is December 28th, 9:02 a.m. I want to thank everyone for being on the call. I hope everyone had a fantastic Christmas weekend. I know I did, much needed break and, a way to charge our batteries and get ready for the new year. So as you know, it's a very short week this week. Again, we have another holiday this week. Thursday is New Year's Eve, and then Friday is New Year's Day. So very quickly, hours of operation for this week. Health Plan Markets is open today, tomorrow, normal hours. So Monday and Tuesday, 9 a.m. to 6 p.m., we are here for you. On Wednesday, we are doing another half day, so we'll be open 9 a.m. to 12 p.m., and we'll be closing early on December 30th to prepare for the new year. And then we are closed December 31st, which is New Year's Eve, and then New Year's Day we are also closed. So those are our hours of the week this week, and then we will resume normal working hours on January 4th. So we'll have that going for you. We're back at it a week from today, so we can get back on track. So that is what's going on. We also have our training calendar. The training calendar is obviously very slim this week. So this morning at 11 a.m., Devoted is doing their weekly broker coffee and chat session. You can call in and get questions answered and talk to a broker manager at Devoted. This one specifically in the Orlando market, but all are welcome. Great way if you have questions, even if you have basic questions about Medicare or something like that, they could definitely help you out. I know Jeanette's a great resource for those types of things. So the only other training I see on the calendar is on Thursday, December 31st, New Year's Eve, a Devoted Jacksonville Market coffee and chat session. Again, another broker manager session you can get on there, and that is on Thursday at 11:30. You can jump on there. Again, the training calendar is available for you. Please make sure that you have access to that. You can download it on your laptop, phone, or iPad, so that way you can see what's going on for training in the week. As I always say, you should have one foot in the classroom and the other one in the field at all times. Just the nature of our business, it's always changing. All right, so as we're wrapping up the new year, or the year to get into the new year, and most of you are running as fast as you can out of 2020, I don't blame you. But we've got commissions, so I'm getting commission questions. When do we get paid for our 1/1 effectives? So the carriers are sending out emails on what to expect with your commissions. The first to announce is United Healthcare. They're expected to drop their first commission payment on January 2nd, which is actually a Saturday. But I would expect you should start seeing payments right around the 4th, which is January 4th, which is a Monday. So that week is most likely when you would start receiving your commission payments for your Medicare Advantage. For ACA, you're looking at not until probably mid-February until you start to see your 1/1 commissions for, your Oscar payments, your Bright Health payments, and that kind of thing. Now, some of you have done so well with ACA that there were bonus payments, and you're starting to receive those bonus payments now, and that's great. So you'll start to receive some of that from Bright Health. I think Oscar's starting to pay their payments this week, but the actual commission itself for the policies, you probably will not see that until about mid-February. Some companies might even be March before you start to receive those January 1st effectives. That's just because they have that grace period until the 31st, so the carriers use that buffer time to make sure that your clients are properly enrolled. So that's what's going on with the commissions. Now, as a reminder, it is the 28th. You still have about 3 days left to close out 1/1 effective, so you could still put new business in if you've got an SEP, and we talked a lot about that on the other calls. But most importantly, in my opinion, you guys should be checking on those applications. Please make sure that you've double-checked on your apps, that all of your clients have been properly enrolled. It takes a few minutes per carrier, obviously, but go in there, call Humana, call United, call WellCare, and just make sure that the applications have been properly submitted and if there's any issues. I know that certain carriers are notorious for not telling us that there was an issue for the application. Some are way better than others. But remember, it is ultimately your responsibility as the agent of record to ensure that your member is enrolled. Even if you processed it through us, or you faxed it in or forgot about it, or you did an e-app, it doesn't matter how you submitted the application. It is ultimately your responsibility to check on that application and ensure that the member was properly enrolled. So take some time this week. If it's a little bit slower for you, this is a great time to check on those apps, make sure they're absolutely 100% in. Because if there is an issue, if an app was not processed or the carrier misplaced the app, which has happened, you still have 3 days to correct course, right? You can't do that in January. It's over in January. So remember, you got this buffer window. This is a great time, a great reminder, to check on those clients and ensure that everybody's been taken care of, okay? So that's what I would be doing this week and to ensure that everything is up and running for you and for your members. Okay, moving on. All right, Humana has notified you guys that they're doing a bonus for their dental product. And if you're already contracted with Humana, you automatically get their dental plan. And they've rolled out some new plans this year if you haven't seen those. But most of their plans start at about $12, $13 a month. So a great little dovetail for your senior folks and even for your ACA folks that are looking to add some dental benefits to their package. So very inexpensive plans. But they are offering you a bonus. It says that you can earn a $100 bonus when you sell 5 new eligible individual dental plans between January 1st and June 30th, 2021. So 6 months. If you write 5 dental policies, you get an extra $100. Plus, you receive an additional $20 for every eligible individual dental plan sold above 5. So you get $100 for the 5, and then you get $20 thereafter. So, great little bonus if you can find 10 people in 6 months to add dental to your policies. There's an extra $200 bonus right there, plus your commission, which I believe is 10% of the policy, and that's for life, right? So if you're looking for extra income, hey Justin, open enrollment's over, things slow down, what do I do? Well, remember in OEP in January, you're going to need to call all your clients, and I'm talking about Medicare clients, I'm talking about ACA clients. You want to talk to everybody and call them back. But this is another great talking point when you're talking to your clients, and it's also a downsell, which means that you've got the main policy, right, and then you're downselling them into a smaller subset policy, and that downsell is additional income for you. So how much more could you earn on your clients that you already trust you to deliver insurance products to them, right? Are you offering these things? Don't be shy, because you don't know if your client is dealing with a dental issue right now and they've been searching for dental, or it's been on the back of their mind, or something just popped up. Do them a favor and get them a policy so they can save money when they go to see the dental. And, Humana specifically has a great platform for enrolling people. It's very, very easy to get someone enrolled. It's all electronic. They've been doing that for years. And they even have a PPO product, so they can go in or out of network on their dental program. So you don't have to worry about network on that PPO dental product. So great little tool to talk to your members and offer them something new. And that could also generate leads for you as well, because dental is actually a very, very low cost insurance product, and people flock for you. And they'll come to you and say, hey, you sold my neighbor a dental plan. You get them enrolled in a dental plan, and now you can call them. If they've got Medicare, that opens the door for you as a consent to contact. So dental policies is a great way to open the door for everything else that you do. So very low cost. People are, hey, it's less than a cup of coffee a day, right? That's the whole thing. it truly is on the dental side. I mean, you could pay 50 cents on the dollar every month for a dental plan, or for every day, 50 cents a day for a dental plan. And most people will do that because it's really going to save them a lot of money, and they get the cleanings, the exams, the x-rays, all that good stuff. So just a little bonus that you can earn. Wanted to make you guys aware of that, and it's another great way to keep the door open to generate leads for yourself and also take care of your clients. Now, I'm also going to say something about how policies work with your clients. Your retention skyrockets. Your retention with your members skyrockets when you have 2 or more products with that person. Okay? So if you only have let's say a Medicare Advantage plan with that person, they are twice as likely to leave you if you do not have a second product with them. Twice as likely. That's crazy, right? So you can double down on your retention by getting them signed up with a dental plan. It's amazing because psychologically your members are thinking, okay, well, if I cancel my dental, I'm going to have to cancel my Medicare. If I cancel my Medicare, I'm going to cancel my dental. You just create a stronger bond with your clients when you have 2 or more products with that person. It is actually a fact. It's a great retention tool, and for sales, it's phenomenal. And it also increases your opportunity for referrals, because if somebody is more loyal to you because they have 2 or more products with you, then it also generates referrals, which is your number one lead source. Number one lead source is client referrals. You guys do a fantastic job at client referrals. And so, this is just another way to kick up some more dust for that. Okay, now, speaking of OEP, what do we do? How do we get ready? There's 3 days before AEP. Well, AEP's already ended, but 3 days before the end of 2020. Yes, you can still do business today. If somebody calls in and says, hey, I'm tired of my Medicare plan, what do I do? Well, first thing I would think of is your 5-star plans. We've got 2 of them. We've got Care Plus. We've got Cigna. Both of them are 5-star plans. Both of them have different networks. So take a look at that. If you're not contracted with either one of those, let us know. We'll be glad to get you set up. So you can enroll anyone year-round. The question also comes up, Justin, what happens if I use my 5-star right now in December? Can I use another 5-star again next year? The answer is no. You can only use the 5-star once in plan year 2021. So we are technically now in plan year 2021 because we're writing for January 1st effectives. So if you do use the 5-star today to enroll somebody in Cigna, you will not be able to use the 5-star again in 2021 to move them over to Care Plus. Okay? So just keep that in mind. They got one shot to use it for 2021, and you are currently now in selling plan year 2021. 2020 is closed. It closed on December 1st. So you are in plan year 2021. If you use the 5-star now, you cannot use it again in 2021. Okay? So if you're out there, just make sure that they know that. But however, do we have another opportunity? And yes, the answer is OEP, which is from January 1st to March 31st. You guys can make a change. So if you get somebody enrolled in Care Plus today, 5-star, and it doesn't seem to be a good fit in February, can you change them? Absolutely. You would select OEP, and they would be effective in this scenario. They'd be effective in March 1st, right? So it's a great way to get somebody covered for January, test drive the plan. If they like it, great. If they don't, they still have a get out of jail for free in OEP. But keep in mind, if they have original Medicare only, they cannot join a plan in OEP. So this is why if you have anybody that you talk to throughout the year, and maybe you didn't get to them through AEP right now, call them. Call those Medicare-only people right now and say, you've got one last chance to get in for 2021 because you cannot help them in OEP. Okay, so you can get them set up with a 5-star plan. But once they're enrolled, yes, then they can use their OEP from January 1st to March 31st. So you're actually giving them more opportunities to change. If they're on original Medicare right now, you can help them get enrolled in another plan in OEP, just in case. So I know, for instance, an original Medicare person that doesn't have a plan, they join a 5-star plan just to get them a 5-star plan, but maybe none of their doctors are in network. No sweat. You can get them in that 5-star, and then January 1st comes, you can switch them to the plan that has their doctors. Okay, so you're able to do that with OEP. Just a little technical maneuvering and understanding SEPs. It's very, very important. The other thing I want to remind you is we do have several SEPs available. And I know it gets confusing out there, especially, hey, Justin, what happens if the Medicare A and B are the same? What if they're different? Do I use ICEP? Do I use IEP? What code do I use? Well, guys, this is exactly why we use electronic applications, because all of the electronic applications do the thinking for you. Okay, so when you plug in their Medicare eligible dates, A and B, it automatically slims down your selection of SEPs. So that way there's less errors when you're submitting the application. If you're doing it manually, you better hope and understand how those SEPs work and how those election periods work, because if you select the wrong one, it could delay or reject the application. Okay, so this is another reason why we're leaning towards EAP systems. Now, I could tell you that we are researching a single software solution, so we'll have more on that as we start to research. But for now, all of the carriers, I think almost all of the carriers now have some form of electronic application software. So if you haven't learned it by now, run to catch up, because this is the future, guys. It's not going to go away. It's not a trend. It's not just for 2020. Electronic applications are here to stay. So those agents that understand that and can become efficient doing this, you're going to save yourself a lot of windshield time in 2021. This could be your most effective and most successful season if you learn those electronic applications. And again, if we roll out a new software system, we'll talk more and more about that as we do that. But it's there for you, and I hope that you guys take advantage of it. The agents that have adopted those electronic applications, I have seen you guys run in strides now, whereas before you were running to catch up. So doing excellent. The top producers couldn't have done the sales that they did without electronic applications. It's just a fact. It's just a fact. There's no way that you can run around the city and collect 200, 300 paper applications. It's impossible. That's why you have to do electronic applications. So there it is. I'll get off my soapbox on that. But as you prepare for OEP, what does your activity look like? I think step one, retention. Call your members. Make sure that they're doing everything that they need to be doing. Making sure that they're happy with their plan, and ask for referrals. That's step one. Okay. Step two, get out to see your doctors. If you have relationships with doctors, we'd love to help you with that. We just hired Nick. Nick is going to be helping us with those physician relationships. So if you're working with a provider and you need help, please let us know. We could help support that doctor. We can help them with marketing. We can help them grow. And ultimately, it's our goal to help you generate leads from that doctor. So if you've got a doctor and he's really not pumping it for you, he's not giving you any leads, let us know. If you feel you have a good relationship with that provider's office, let us know. We'll be glad to support you. We'll be glad to take in and help them and invest in their practice and see if we can generate more leads for you from the physician side. Okay. Also, events. Events are big. If you have no other activity, events are still happening. There are still health fairs. There's still food banks. But I think most importantly, there's been a big exodus from the senior communities. And some of that is because they're protecting their seniors, obviously. They don't want a lot of visitors in the senior communities. I understand that. But the agents stopped going out there. So other agents, captive agents, brokers like yourselves, they're not going out to those senior communities, or they haven't been going out to those senior communities. There's a big opening for that right now. So as you're gearing up for 2021, reaching out to those senior communities where people live, right? And I'm not just talking about the mobile home parks. I'm talking about, the skyscrapers where they have, the apartment complexes and the condos and the 55-plus areas. The seniors are still coming out. We've seen this evident in health fairs and seminars. So don't be afraid. If you're bold enough to go out there and help folks, invite yourself, or go in there and set up an event at the senior communities. And a lot of these communities are required by law, by their local government, to do at least 1 or 2 events every month for their seniors. Now, I don't know how that's changed with COVID, but I can tell you that they still need to do some type of activity. So even if it's a day where you help them apply for Medicaid, or they're helping you with something else, you can go out there and you can help those people that are living in that community. Food banks, we're working with some of the physicians on setting up food banks at those senior communities. So if you're interested in participating or learning how these things work, please reach out to Sergio or Victor or a teammate, and we'll be glad to assist you on so you can watch and see what happens for that as well. So events, be out there looking for events this season. I think that that's going to be a big opening, and those agents that can figure out how to maneuver around COVID requirements and getting out into the senior communities to help those folks that need insurance, need health care, need to get to a doctor, need to have surgery and be financially protected, that's our job, guys. That's our job. Let's go out and help our community, right? And ACA also has tons of opportunity there as well, so it's available. So make sure you're looking out for events. So those are the 2 things I would recommend for OEP and getting ready for it. Last thing on my list I wanted to talk about is Tricare and Champ VA, because if some of you have run into those Tricare folks recently, and I want to give you a reminder on what's happening with Tricare, because can Tricare members join a Medicare Advantage plan? The answer is yes, they can, okay? So is it wise for somebody to join a Medicare Advantage plan when they have Tricare? If you have Tricare, you really don't need a Medicare Advantage plan. Tricare is a phenomenal benefit package that's created for military families, and it virtually pays for most everything. But you'll have a lot of folks that have Tricare and Medicare, excuse me, and they're interested in joining a Medicare Advantage plan. Maybe it's because they don't want to use the VA, or maybe it's hard for them to find a Tricare doctor in their area, or maybe they just want the transportation or the OTC or all those extras that they don't normally get with Tricare. Can they join a Medicare Advantage plan? The answer is yes, absolutely they could. But again, it does become sticky. All right, so who pays first in Medicare, right? If you have Medicare, Tricare pays after Medicare and the Medicare Advantage plan. So what's typically happening is if you enroll somebody in Tricare, they've normally had Tricare for a while, and they go to see their doctor, and then the doctor has on file Tricare, and then all of a sudden you've got them enrolled in a Medicare Advantage plan. The doctor assumes that they still have Tricare. They bill Tricare. Tricare says, no, we're not paying because they have other insurance. And guess who gets the bill? Your member. So then they come back to you, and it becomes a mess. So what you need to do is educate those clients. If they are adamant about joining a Medicare Advantage plan, it is their right. They can join a Medicare Advantage plan. It doesn't do them any harm to their Tricare. They still have Tricare. It does work together. But you need to ensure that they understand how it works. Okay? So with Tricare, they can join the Medicare Advantage plan. They can use their benefits, but just let them know that Tricare pays after their Medicare Advantage benefits. And, does it coordinate with Medicare Advantage? They will coordinate benefits to minimize the out-of-pocket. However, some services that are not medically necessary are not covered by Tricare or Medicare Advantage. So that's where they're going to get in trouble, where they might have to pay that deductible or copay or coinsurance amount, is if those services are deemed not medically necessary. That's where you're going to run into some issues. So just make sure your members know. By general default, I always steered away from those folks that had Tricare. If they had Tricare, I thanked them for their service, and I left them be. But some folks, they are adamant. They said, well, my sister has WellCare, or my brother has Freedom, and I really want that Freedom plan. I want to enroll. Then yes, you can enroll them. In fact, if they tell you they want to enroll, you got to enroll them, right? So just make sure that you explain to them how the Tricare works and how the Medicare Advantage works, and why it could cause an issue is because of the providers not understanding who to bill first, and that's where the bills come in, and that's where it causes some issues. But there's nothing wrong with those folks enrolling. Just make sure that they understand how it all works. And if they have questions about enrolling into a Medicare Advantage plan, always refer them back to their Tricare benefit administrator, wherever that is. They get letters from Tricare, and they have a contact and customer service number for Tricare. So if they have any questions on how Tricare would work with their Medicare Advantage plan, if they're nervous about that, of course, have them talk to their Tricare benefit administrator, and then they can get those answers. But specifically, can they enroll? Yes. Tricare pays last. Medicare Advantage pays first. But it's that issue with the providers not understanding what happens and how to bill, and that's where you get into those issues. So that's why most people stay away from Tricare, because it causes a lot of issues. But it does not disenroll them from Tricare. No one can disenroll them from Tricare except themselves. They could call Tricare and disenroll. I don't know why anybody would do that, but they can do that. But that's how it works. So with that, I am done with my call, so I'm going to go ahead and open it up for questions. So if you have any questions for me or any comments or suggestions, now's the time.
Yeah, Justin, good morning.
Good morning, Pedro.
Hi. How do they coordinate benefits, between Medicare or the Medicare Advantage plan and Tricare?
So coordination is at the actual healthcare provider. So let's use the primary care doctor as an example, right? So what's supposed to happen is the member shows the provider their new Medicare Advantage card, and they have Tricare and they have Medicare, right? So now that they have Medicare Advantage, their Medicare card is tied into the Medicare Advantage. They're not going to use that Medicare card anymore because it's running through the Medicare Advantage. So they put that one away. So they need to make sure that their provider knows that they have a Medicare Advantage, and then the provider bills Medicare Advantage first, okay? And then anything left over, like their copay, they would bill Tricare. Okay?
Okay. Go ahead. I'm sorry. Go ahead.
No, yeah, that's basically how it works on the provider level. Now, just keep in mind, I'm not a Tricare benefit administrator. I don't work for Tricare. I don't have a lot of experience with benefits in Tricare. So what they do pay for and what they don't pay for, I don't know. That's something that the member has to call and get clarification on.
Right. Another thing is that I understand that some VA folks, they can claim Medicare Advantage plans, co-pays, they can claim it on a special form that they have at VA.
Mm-hmm.
I mean, not all of them. It depends. It looks like their level. I don't know. But I understand that they can do that. Have you heard something about that?
I have, and thank you for sharing that. So, and what you're talking about is actually getting them reimbursed. Is that correct?
Correct.
Right. So if they've paid their copay at their doctor with Tricare or Champ VA, and they did pay a copay, let's say that they're at a specialist, it was $35, just as an example. They can use that form you're speaking of and submit it and possibly get reimbursed for that copayment. But I have also heard that. Yeah. Mm-hmm.
Okay. Thank you.
Absolutely.
Hey, Justin. I had a question about. I put one of my members. They wanted a PPO, not an HMO, so I switched them. And their doctor is on both plans, but it seemed like their doctor didn't want to take them back on. They told them that that her panel was full as far as that PPO when it wasn't. Is there a reason why a doctor would rather have HMO than a PPO as far as their clients?
Absolutely, and this is something we should probably cover in another call deeper, but very quickly, absolutely, Bruce. So what's happening? Let's talk about the financial level of the provider group. So on an HMO, and you may be aware of this, the HMO, the member, the doctor gets paid a per member per month capitation, and then they also get additional funding based on their contract with that Medicare Advantage plan, whether they're through an MSO or an IPA. So that particular member on an HMO is worth more money than they are on a PPO. Okay, it depends, right? If the member is healthy, doesn't see the doctor, is compliant, takes their medication, and maybe comes in, once or twice a year for their regular checkups, that's a very profitable member for that practice. Now, if you change that member to a PPO, you're moving that financial agreement from a fee-for-service capitation or from a capitation to fee-for-service, which means that instead of the doctor getting a membership amount every month for that member, whether they come or they don't, they get paid on that HMO, right? On the PPO, if you move that member, the doctor's not going to get paid for that member unless they come into the practice, right? So for fee-for-service, it's a great option for somebody that's very, very sick and needs to see the doctor a lot. For the practice, that's financially better on that side than it is for the HMO, because if they see the member a lot under the HMO, they're not going to make much money. So if it could be that the provider looked at that member and says, well, I don't want to take you on as a PPO member because I was making money with you on the HMO, and that's their way of steering them back to the HMO. I've seen that happen, right? But that's on the financial side of it, right? I don't know why a doctor would close their panels on the PPO product and not the HMO if it's the same product. That's really rare. It could happen. They could close their panel, but if they're indicated as being open, then they do need to accept the member. But if they want to close their panel for the PPO in general, then they need to contact the health plan directly and have them close the panel for that particular product. And we've seen that. Like, they've been open for PPO but closed for HMO or vice versa. It does happen, but it's rare. I've seen it happen both ways. But financially, financially that's how it would work on the doctor side.
Okay. And I think that maybe she just told him that so he would switch, but I'm not sure. So, all right. So if you have time, can you explain a specialist and an HMO PPO? real quick?
Yeah, so they're virtually paid the same on either the HMO or PPO on the specialist side. Most of the agreements are fee-for-service, meaning, again, that if the member comes in, the doctor gets paid. If the member doesn't come in, the doctor doesn't get paid. Okay? And that's different than the HMO capitation agreement. But, yeah, so the specialists are virtually the same. They get paid virtually the same on an HMO and a PPO.
Is the primary care doctor, is it to their benefit not to send them to a specialist?
Yes.
HMO?
Yes. They every time, and it depends on their arrangement, but for a lot of primary care doctors that have HMO members, when they send their member to a specialist, it comes out of their pocket, not the health plans.
Okay.
Justin.
Mm-hmm.
Hey, thanks.
You got it.
That doesn't apply to Freedom though. Freedom has a different setup for the specialist, so there's not the obligation to to share any of their and that was the specific design by Dr. Patel when he first started that company.
Mm-hmm.
So, but it's Freedom. I don't know, like the others, Humana and so on. They may go through that where they're having to pay. Therefore, the reason why they become a specialist, from everything from cardiac to you name it, because they don't want to share any of their monies with their specialists.
Right, and thank you. Well, I know you used to work for Freedom, so that's why you knew that. And it could be different for each carrier specifically, like Will's saying, like Freedom doesn't take it out of the provider's cut per se. But in general, that's why HMO doctors hesitate to send their members to the specialist. And that's a general statement. And again, it depends on their financial arrangement with the health plan. And like Will had mentioned, Freedom doesn't penalize the HMO doctor for sending out to the specialist. But what you should know is looking at the global picture of how these health plans generate a star rating. And that star rating is one of the metrics in the star rating is how well are they controlling the cost of their membership. And if you're a doctor that's always sending your patients to specialists, you're not controlling the cost of your membership. So that's why these health plans have created a referral system, because it's a control cost feature to prevent members to do whatever they want, because that costs the health plan a lot of money. And it also is a metric in their star rating. So we need to cover a whole course in this for sure, because it's a lot of moving parts, and you guys will have a fantastic, better understanding in how to work with physicians. In fact, Nick and I are creating a training session for you guys, and we'll do a special training exactly on what we're talking about, how the doctors are getting paid, how the HMOs work, and why they do what they do. So that's coming in 2021. So great questions. And Nick, I know you're listening. If you could take notes on some of these questions, I think this is definitely something we should attack in our training.
Yeah, absolutely. And this is something, too, to think of is every specialist is a little different. Some like to run a lot of tests. Some don't like to run a lot of tests. So that's where these doctors, too, when they have a certain group that they want to refer to, that's some of the reasoning behind it. They go pretty often together or whatnot. It's because they know this specialist won't send my patients through 15 tests when they only need 2 tests, or they won't prescribe this expensive medication because they use this one or whatnot. So there's a lot of moving angles on that, and yeah, we'll definitely hit this in 2021. I think it'll be a great training to do. So absolutely,
and these are all fantastic questions, and thanks for bringing that up, Bruce, and your input. Will, that's incredible information, and it's good information, because now you can start to understand why the doctors do what they do, and that helps you better build those relationships with your provider groups, because now you're thinking like they're thinking, and you can help them grow their practice, not only by membership but by profitability. Great questions. All right, anything else I can help with this morning? All right, my friends. Well, if that's that, I wish everyone a happy new year. I won't see you until next year. But I do appreciate your time being on the call, and we'll continue this call again in 2021, and we'll see you January 4th. So everyone, please be safe out there. Enjoy your time off this weekend, and just remember to close up 2020 nice and tight, work hard, and get through it. All right, hope everyone has a fantastic day.